forward. Do we need the mics, do you think? Can we be fine without the mics?
Can you hear me?
Oh, it's being streamed. Is it better to, it's not super loud, no? It's being live streamed, okay. Okay. All right. Martha, come. Oh, Judith didn't want to come to the first row. She moved from like fifth row to third row or whatever. Okay.
That's still a big jump.
It is a big jump. On Friday nights often we're like, please come, you know, it makes it, and no one moves. It's incredible. I'm not speaking to you because you're already up close. You're not responsible for the, but it is amazing that people are very, you know, settled in their spaces. That's right. Nowadays, like in my kids' classrooms, at least in elementary school, they would shift them. Like you'd be like in a spot for a couple of months and then they shift you because maybe they don't want you to get stuck in. We're trying to sit in the circle so it's a little more warmer environment. Hi Rhonda, hi Iris, hi Sonia.
I've got new reading glasses, and I'm like,
My glasses. I need them for distance. I don't need for reading, but they're progressive. So I used to have to go like this.
I was telling my friends, and I was in Europe this past couple weeks about the word. They were like, "What's progressives?" They've never heard the word. I'm like, it's a nicer word for bifocals that I have.
That's right. There you go. There you go. All right. Hi, Jeremy. You want to come sit here, Jeremy? I don't bite. Anyone who would like? Okay, so welcome everybody. So happy to see you, and and welcome those who are on live stream. Whoopsie. I want to introduce Rose, who's new to our team. She joined our staff in August, end of July. Yeah, and she's working in the adult engagement programming, split between two areas of programming. One is Aviv, the 20s and 30s, and one is the social justice work. So, so we're really happy to have her here, and I hope everyone will get to meet her along the way. And also, particularly, Kiana is now on maternity leave, so she hasn't had the baby yet, at least as of yesterday. So,
I thought someone told me
did she have the baby yet?
I thought I was told this morning, but maybe I'm wrong.
Oh, maybe I haven't been with Shabbat. I haven't heard. So we'll let everyone know. Anyway, B'Sha'at Tova, if she hasn't had the baby yet since Shabbat. So welcome. We thought, actually, it was Kiana who suggested, because of our deep relationship with WSCAH, with West Side Campaign Against Hunger, and Greg and I and Rolly and Shuli have been in conversations over the course of a number of years about our collaboration and about the work. And we thought, particularly in light of the High Holy Days coming up and our giving of our raising money for WSCAH, it would be important to create a venue for people to hear from Greg about the work of WSCAH, which the truth is has dramatically shifted under Greg's leadership, and so it's really powerful to hear what's happening. And before we even go into the kind of conversation piece, just tell us a little bit about you, because you have a great story about your story.
Geez. Well, it's interesting because I was saying before to the rabbi that coming to B'nai Jeshurun is the closest I can get to, like, I grew up in upstate New York at Temple Beth El in Utica, and I'm like, I go to a lot of temples and synagogues around in New York, but the actual prayers and everything sounds very familiar. So it's super nice to be here and be part of the congregation today. I'm a chef by training. I had 3 restaurants for about 15 years in Ithaca, New York. So cafe, farm-to-table restaurant, wine and whiskey bar, not what you expect from the anti-hunger person maybe. And I always wanted to feed my customers the best food. And I worked with dozens of farmers and got the best food possible for my customers. And at some point, restaurant work wasn't enough. So I became a Peace Corps. I left to go to the Peace Corps in West Africa. I was in Mali for 2 years it ended up being business development, supporting restaurant folks. And then I got back into the restaurant world. And at a certain point, I just wanted to be doing more giving back, I guess, to the words of what was it, Tory today, like doing like more mitzvahs, right? Like I just wanted to do more. And I sold my restaurants 3 weeks before the financial collapse of 2008. So I guess I have some good luck. And I followed my now wife to England for her PhD, and I started working for the City of London doing nutrition education. The first chef they ever had who was actually, instead of a nutritionist or a dietitian teaching cooking, I was a chef teaching cooking. Seemed very easy to me. And I started working with schools as well, looking at how schools, their menus were planned. So I was getting hired by different parts of the boroughs of London to revamp school lunch meals. And so I came back to the US, to Washington, and got a job with a national anti-hunger group, working in anti-hunger work, leading a lot of the work under the Obama administration with First Lady Michelle Obama on school meals and nutritional facts panels and dietary guidelines and shifting from a food pyramid to my plate. And so when my wife got a job at Columbia in epidemiology, I, of course, followed her to New York. And next thing you know, I've been at West Side Campaign Against Hunger for 8.5 years. And to me, it's like a small independent restaurant. Like, we're not a big chain. We can move. We do what our customers want. We get to meet our customers every day. And we change things up as rapidly as we want because we know what our customers need.
Great. So I just think it's a powerful background to Greg's work, and at least when we've spoken, I feel like your desire to feed people good food is just a consistent trope in how you think about the work writ large, and because I think we often think about just getting them food, and one of the things that Greg has prioritized is getting healthy food. And anyway, so at BJ, we've been obviously feeding the hungry is a part of our core mission. It's a Jewish value. It's a mitzvah, and the partnership with West Side Campaign Against Hunger, also with the church, has been a core part of our work as a community, with the lunch program, with West Side Campaign Against Hunger. Of course, when we had the shelter before that changed during the pandemic. And West Side Campaign Against Hunger has been around for 46 years. And Greg, I was curious how many years it's been. 8.5 years has been leading it. Could you just share a little bit about when you came to West Side Campaign Against Hunger, what it was, and how it's evolved and changed over the time that you've been there? And also, obviously the pandemic had a huge impact in that, and for anyone who walked in the church during those years in particular, the sanctuary of the church essentially became a warehouse for the West Side Campaign Against Hunger. So share a little bit about kind of when you arrived and what shifted, and then we'll go from there.
So yeah, when I arrived to WSCAH, it was like an independent restaurant. It was a one location distribution place, right? And I think the story of WSCAH is that it's at 86th Street and that it's feeding people in the Upper West Side. But for as long as we realized, and the research had already been done, I was given sort of research briefs, the customer base was from all over the city because we had the best food in the city. And at that point, we were giving out about 1 million pounds of food a year, and about 10 to 15% was fresh produce, and that was considered best practice across the country. People were coming from all over the country to see our little pantry where we gave people a choice, because no one had ever done that before. Well before my team under Doreen Wall, like, they created this model giving people a choice of what foods they wanted. Now, this wasn't Whole Foods, right? This is this is a small grocery store, half the size of this room, giving a choice between 5 different vegetables, 5 different fruits, but that's exponentially more choices than what it used to be, which was a bag of shelf-stable cans and that's it, and no fresh produce. And when I first got to WSCAH, like right as a customer-centric former restaurateur, like I want to get my customers the best food possible. And one of the first things that happened is one of my staff came to me and said, Greg, we just got a delivery, and from what we know about you, you are not going to be happy. And I said, so what is it? And it was a truckload of soda, rice-a-roni, hamburger helper. We all have our sometimes foods. It's okay. But like a truckload. And this, and I was like, what is this? Send it back. And they're like, we don't send food back, it's a donation. And so this counts as our poundage of what we're giving out. I'm like, why are we giving out things that are gonna like hurt people's health? And they're like, we have no idea. So I called up the donor of this, and this 18 pallets roughly, so more food than it'd probably fill up half this room. And I said, hey, I need you to do a pickup. And they said, we don't do pickups. And I'm like, I need you to do a pickup. And then they said, can you take down that Instagram post where I took a picture of it? And I just said, sometimes folks do more harm than good when they sacrifice people's long-term health for poundage. And I had a whole weekend argument via phone, text with the head of this organization. And on the Monday, we came to an agreement, which was I refused to back down, and she would have to pick up the food, or I would put up more social media posts, and I would actually call out the organization, which I didn't. And I've subsequently written a chapter in a book that talks about this as well. And they picked up the food and said, we're never going to send you those foods again. And I was like, thank you. And so our poundage went down significantly that year. And different funders like Robin Hood said to us, you guys are inefficient, your poundage is down, you're not distributing as much, you came in, you're supposed to do all these great things. And I'm like, there's something you're not looking at. What's our percentage of fresh produce? And they're like, well, it's doubled. I'm like, yeah. Like, well, that's not something we track. I'm like, you should. So over the couple years, we went from 10% fresh produce to 20 to 30. We're now giving out 5+ million pounds of food a year, not 1 million, and about 55% of it is fresh produce. So almost 2.5, 3 million pounds of fresh produce. And that to us is like the baseline. And so we've shifted to say, look, we can get better food in terms of choice even of like what products, and we're gonna bring food to people instead of people to food. 86th Street is where we're based. It's an incredible location, but our customers come from far away. So even before the pandemic, probably some of you voted in participatory budgeting when Helen Rosenthal was the council member here. I always forget if it's where Daniel like the border is close here.
There's a mix,
yeah, there's a mix. That WSCAH got a mobile truck through that participatory budgeting. And we used that and opened up 13 new distribution points where our customers were coming from. And that's evolved. You know, the height of the pandemic, we had 50 distribution points. Now we have about 25 distribution points, mostly north of here. And we have about 1,500 new moms as well who get home delivered groceries. So if you are a mom with a newborn and you show up at an emergency room at New York Presbyterian and you get screened for your intake questions, and one of those questions is about food insecurity, if it turns out you're hungry, you're going to be offered, would you like home delivered groceries every other week for the next 6 months? And you choose, do you want alternative dairy? Do you want regular milk? Do you want protein? What type of proteins? And we will deliver that as if you were getting Instacart or Fresh Direct. And that program was built, which is quite interesting to be at B'nai Jeshurun. So Marshall Meyer, right, Rabbi Meyer, who I never had the good fortune to meet, his daughter, who I know very well, Dodie Meyer, is the pediatrician who built that program with us. And so we, every day are delivering food to people's homes, bringing food to neighborhoods, and still having the largest distribution point we have is 86th and West End. At the height of post-pandemic, we were distributing to 600 families a day just at this one location. And so we've expanded the scope. We still do distribution. We're still doing benefits enrollments. We have a whole team. that follows up with every customer and helps them get access to the benefits that they are eligible for. Unfortunately, like there's more and more people in need and less who are actually eligible for different pieces of benefits, and those benefits are shrinking. But we've just brought more food to more people in more ways that are, to us, choice wasn't just about, do you want an apple or an orange? Choice is about, do you want fresh produce? Do you want your groceries delivered to your door? When do you want your food? Where do you want your food? How do you want it delivered? Do you want to volunteer with us? Do you want to advocate with us? Every choice that someone should have.
Amazing. Can you say a little bit about the warehouse?
Oh, yeah. My pride and joy. Because, right, in the pandemic, we were using the entire SPSA sanctuary as a warehouse space in some way. Like, that was not sustainable. SPSA, St. Paul Sanctuary, is an amazing church. It is not a supply chain warehouse. It was not meant to be. And we've definitely beat up the walls and things of that building. And so,
which weren't in great shape before.
Yeah, they weren't in great shape before. But so we looked all over the city, and we ended up finding a disused U.S. Postal Service hub in Washington Heights. So it was the retail post office on 180th, and it was also their warehouse for all of Upper Manhattan. And we put a 20-year, we signed a 20-year lease, and January of 2024, we opened. So we don't do any direct distribution to customers there, but we have internal docks and trucks coming in, and we have another 30 to 40 volunteers every day packing food at that site. We have a walk-in cooler, a refrigerator that probably is roughly the size of this room. So if you've been to 86th Street and seen the walk-in cooler, it's probably the size of like this area right here. So I think it's 10 times bigger. We have a massive ability to purchase more fresh food and store it and move it faster. So it's just been great. And it's also located in the area where most of our distribution points are. So it's a lot of easy distribution to different community partners.
And can you say a little bit about one of the other things I've heard you say over the years is around the collaboration piece that, like, I mean, this is actually something we've been thinking about a lot around our justice work writ large. It's like we don't even know what other people are doing. And so we duplicate efforts. And if our goal is to, I don't know that we'll ever solve food insecurity, but if our goal is to make the greatest dent that we can and to feed as many people, often we're not working with, and that's on lots of issues. I've been saying to Kiana and Shuli that one thing I would like to do, and maybe we should do this together, is like have a map of the Upper West Side about all that's happening around mitzvot, because it's likely that we're duplicating resources. And one of the things I think that Greg has done is strategically think about how bringing more people to the table will push more food out and make it a more powerful force to actually advocate and get more funds. So could you speak to that?
So it goes back to my restaurant world. So when I had restaurants, I hated my pricing. I knew I was getting bad pricing. No offense to anyone who's in wholesale food. I grew up in wholesale clothing, my family business, parents' family, so I'm used to this. But I was like, this pricing is bad, and this is back in the 90s when there was fax machines. And I took every pricing list I got from every distributor, and I put it onto one fax. And I sent it back out to all the distributors. And I said, here is all of your competitors' pricing. If you want to sell to me, you will have the lowest price. And they're like, you can't do this. You are not allowed. I'm like, what do you mean? You can't send out our pricing. I'm like, what? Is this like a law? They're like, no, but it's bad. And so my price, and I shared it with other restaurants, my competitors. And people were like, why are you doing this? I'm like, I want everyone to have the best food possible. And that's how it's going to happen. And so change your pricing. And so when I got to West Side Campaign Against Hunger, first thing I did was I went to the other big emergency food organizations and met their leadership, and I wanted to learn from them. Like, what are they doing? And I was like, my gut tells me we're all getting ripped off. And they're like, well, yeah, but no one has the time to look at this stuff. And I was like, if I get the money, would you work together? And we started out with New York Common Pantry, which is on the Upper East Side, St. John's Bread and Life in Brooklyn, and Project Hospitality in Staten Island, and we took every invoice for a year and collaborate and pull them together and put them all into one database. And lo and behold, there was a variance of pricing from the same distributors. The best example was New York Common Pantry was paying, I think it was 10 or 11 cents less per quart of milk than we were from the same distributor. And so we went back to the distributor and I said, here's this list. You need to change these prices. They're like, well, you're on a separate contract. I'm like, so I come to you as leader of this sort of collaborative, which didn't have a name. It's now called the Roundtable. And I need you to make everyone's prices the same. They're like, they don't work for you. You can't make us do this. I'm like, you can either lose New York Common Pantry as a client or potentially gain these two other partners. And they're like, but Common Pantry doesn't listen to you. I'm like, test me. Common Pantry has agreed that you need to do the right pricing. They lowered our price. That milk price ended up being a $12,000 savings per year, just on that one product. So we added, and and I will say, if those of you remember pre-pandemic, Deborah, who was living in the sanctuary at St. Paul, St. Andrew, she was living in sanctuary with immigration issues. She was bored to tears, right, living and not leaving that church building. She inputted for months these invoices for us.
I didn't know that.
It's incredible. Like, she made this work happen. So we
Just for people who don't know, the Church of St. Paul and St. Andrew, we're a sanctuary synagogue, but we don't have the facilities to actually house someone because we don't have showers and things like that. This Church of St. Paul and St. Andrew does. And they housed someone it was like over 2 years, actually.
2017.
Many of us also cooked, for their family. And then they later housed about 5 migrants from Venezuela. Anyway, so many of us met her, and she was often people are bringing meals for her family to feed them at times when they needed. So that was a couple of years ago it was like over 2 years, I think.
Yeah, she's amazing. So we came together. Now there's 10 organizations that we have a whole consultant team who we have funding, and we have a consultant team who looks at pricing across 10 organizations. So many of you probably know Met Council on Jewish Poverty, right? Met Council is a member, City Meals is a member, Holy Apostle Soup Kitchen downtown. We share all of our data on pricing. We share our data on everything. When we built our truck and Common Pantry wanted to do a mobile truck, we shared our architectural drawings. We shared our budget. Like, why would we not share there's no secrets here. We're trying to all fight hunger. We're not in competition. And so we've been able to work together on purchasing, like data on collectively purchasing things. So now we'll purchase, a tractor trailer, 33 pallets of milk or of oats or of dried beans together and have it distributed to each other, and that lowers the price by upwards of 50%. We advocate together to the city and state, to elected officials, less on a federal level in the past, but obviously even more now. And I don't know if there's any purpose in advocating federally right now. And we just provide mutual support for each other. Whatever, you have a new HR staff member at one organization, go tour the other organizations and talk to each other. So because we don't have the resources, that's like as a nonprofit, like no one has, folks working in small organizations to like do a data deep dive on your pricing. But across 10 organizations, we can actually fund that, and so we do that work, and that's our it's called the Roundtable, and we're super proud of that. So it's become a big part of WSCAH's work, is being the sort of founder and sort of sponsor and holder of the Roundtable, but we do that because we're such believers in collaboration.
Which is so countercultural, right? Like, to say that everyone is so territorial and wants to be seen, often, even in the best work, right? Like that injustice work, people aren't always collaborating, and I think it just speaks to like there are really practical consequences, money saved, more food bought, right, better pricing, and also advocacy that serves everyone well, which I think just like the energy that Greg brings to that is unusual, and it's made such a huge difference. Can you speak a little bit about like the definition of food insecurity and some examples of how that shows up in the clientele of WSCAH?
Yeah, I mean, right, being food insecure, you have an insecurity of food, which means that at some point in the month, not every meal, not every day, but at some point in the month, you are without food and you can't get it. You have an inability, whether it's most likely it is not access physically, like I can't get to the grocery store. It's a lack of funds to actually get those needed foods, and that they are healthy foods. Like that's a more and more part of what people are more shifting to, this idea of nutritional security. Like, do you have the healthy food necessary to thrive as a human being, right? Like, when we don't have that, we know what happens, right? The easiest thing, I talk about this with kids all the time, the word hangry. What happens? Like when, if you are hungry, you get angry, right? Like we all, like if you don't eat, it's like why, I used to do a lot of more school meals work nationally, and we saw that fast food restaurants around the country at testing time were doing discount meals at breakfast, because everyone intrinsically knows that if there's one time you're going to make sure kids are fed, do it at testing time, because they'll do better if they have food. Like we all do better if we have food. So people who are food insecure are those who just can't make ends meet, right? The West Side Campaign Ends Hunger, almost any pantry in the city, the state, or around the world is giving out groceries to people generally monthly. And it's a 3 or 4 day supply of food that really is a top up to help people get over the hump, to keep them food secure, because between part-time jobs or full-time jobs and getting SNAP benefits, and maybe they go to a soup kitchen, all the different pieces, they still can't make it work, and they need an extra thing to get them over the finish line. And that's what we're trying to do. I was just looking, we were making actually a proposal to UJA with Met Council this week, and there are some stats in the last 10 years, like the number of full-time employees going to pantries in New York City has doubled. Like, you're working full-time and you are still food insecure. Like, you're still going in every day, whether it's 9 to 5 or working nights, whatever it is, and you still can't make it work. And so that's where we step in, right? Because there is not a safety net of substance in the United States, and it's getting worse, charity has to step in. People are like, oh, do you want to put yourself out of business? No, I don't. We're never going to sadly be out of business, right? But we're going to always be here to make sure that people get the food they need, and we're going to push city, state, and federal electeds to transform their systems to get a better and better safety net. But it's this balance. Like we saw it in the pandemic. You saw, MTA bus drivers pulling their buses over, and they're like, hey, can I get some of that food? They're like, yeah. You're like, wait, you're an essential worker, working full time, and you're still like, I need food. So like at most pantries like the West Side Campaign Ends Hunger, we don't have some income attestation to say like, oh, how much do you make? Let's see if you're eligible to get food. What we believe is if you need food, you need food. And if no one who has the means is gaming the system because they want to wait in line to get food, if you could just walk into, Gristedes or Whole Foods or whatever, like it's in no one who has the means to do that is going to do it. And so that's the shifting nature.
I mean, that's also, I'm sure Beth would speak to this, but that like in the lunch program, and particularly when we were having the full sit-down meal, the number of, as the weeks would progress, more and more people come by the end of the month because people's paychecks run out. So, or by the way, when we had the shelter with the Church of St. Paul and St. Andrew and us, the 5-night-a-week shelter, a good portion of the people staying at the shelter had jobs that they went to every day, but they just didn't have the housing, so it's like we have sometimes a perception of who the people are who don't have enough, and it's people who are working full time It's people who just things run out for them, given also in the city how expensive housing is and all those things.
I was just going to say, it's amazing. I ended up having my old college roommate came to visit from decades before, and he was like, everyone looks like me. Like, people are pulling up in cars. I'm like, you don't know. Someone has a good job, they lose their job, they got 2 kids in college, and they're trying to make it work, and maybe they're recently divorced, and they're like, they have nothing left, and they're like, I'm going to make sure my kids stay in school, and therefore I'm going to go hungry. Like, who are we to judge where someone is at any given point? Like, so it's constantly like we have people coming to us and pointing to us like, that person, I don't think they should be in line. They have a cell phone. I'm like, it's probably their means of communication. It's not like, do I want to go to their house and say, oh, do you have let's see, how many TVs do that? No. Like, they are in need, and they're coming to get some food. Yeah, I mean.
Could you say a little bit about, if things have gotten better post-pandemic, and also given the issue of migrants in the city, how that's kind of played also into your work?
Yeah, I mean, I think, right, the pandemic was tragic for many, many people in many ways, but it was an opportunity where we federally and at a state level tested out additions to a safety net. For seniors, for school meals change, for giving electronic benefits in the summer instead of summer meals. All these things were implemented, and childhood food insecurity went down. Like, senior food insecurity went down. Like, it is evidenced, tested, it's been evaluated. Like, it's a no-brainer. Like, everything we always said was going to happen if we implemented these programs, we had this crazy opportunity in the pandemic to do it, and it worked. And then at the end of the pandemic, we started getting calls from seniors. Hey, I was getting $116 a month, and now it's back down to $16 or $18 a month. Think about this. Your SNAP benefit being this food stamps, how is $18 or $20 a month? What is that doing for you? Like, you try shopping even for a couple days' food for that money. Buy a quart of milk, a quart of strawberries, maybe a container of cereal, loaf of bread, like, you're there. Eggs, don't even try to get eggs. And so all of a sudden we're like, oh my, it's all got rolled back. So that's when we started seeing the pre-pandemic, maybe 86th Street was serving 100, 150 people a day. Height of the pandemic, 300-400 families a day. A year after the pandemic, that's when we got up to 600-700 families every day. I mean, our busiest days of the year used to be pre-Thanksgiving for our turkey drive. We would serve that week 700-800 families. And then we just started, after the pandemic, every day, that same amount. And it hasn't let up, right? The need has skyrocketed, and we realized at a certain point, we can't we can't feed the entire city at the West Side Campaign Against Hunger. So we actually, in January, 2 things happened for us. We decided for the first time ever to stop accepting new customers at 86th Street. I mean, we have 25 other distribution points where people could also go to. But also, we can see our numbers. We track everything in our database. Mid-January, when the new administration came in, our numbers just plummeted. And we see this across the city. Our families who are from families with precarious immigration status, they stopped showing up because they were afraid. It doesn't matter that you put a sign outside a church or a temple or anything saying like, ICE isn't welcome here. Like, ICE is going to go into your subway station. They're going to go on the subway. It just doesn't matter. And so that fear, it was real and is real. And we've just opened up what we're calling community hubs. So in our highest need, in the zip codes where the largest number of people who are not showing up to 86th Street from the last year that we can see where they were from, we've opened up 6 distribution points so far that are they're new, they're not big locations, and we can email everyone and say, would you like to come pick up food this week? So we're bringing food closer to home for people because the need is not going down. the city and the state are not adding, there's no increases of budgets. We know what we're seeing in budgets at every level of government. And we know in the coming, it's been talked about, the big bill, most of those cuts are going to happen after the midterm election, which is more politically, convenient. But so people are sort of supporting anti-hunger groups, I think, right now, thinking we'll fix it now. But the real pain is going to come not this November, but the November after.
Can you speak a little bit about what you're anticipating or planning for in terms of budgets and SNAP and all those things?
I mean, it's partly one of the reasons, and some folks are like, why are you constricting 86th Street? Like we're still serving, I think, twice as many people as we served pre-pandemic. What we want to do at every distribution point is back to give people amazing service and be able to bring the food where it's most needed. So if the 86th Street location can go more in depth, for example, with folks from 10022, 23, 24, 25, 26, instead of folks from 1050, then we can be more responsive to the needs more locally and doing that at every location. And as needs change, and what happens for us is community organizations reach out to us and say, we're thinking about opening a pantry because our workforce development nonprofit or our HIV nonprofit, everyone's hungry. So they come to, and we are known as this group who will say, look, don't open a pantry. We can bring you food. You want it twice a month, 3 times? Well, how do you want to set it up? And we can provide that. So we want to keep being able to provide more distribution points at sort of pinpoint accuracy as it changes, because the needs keep changing. Like you look over 10 years ago, where are different populations settling in the city even? It keeps changing. And so we want to just be responsive. I will be honest and say, I have not heard anything from the city or the state in our conversations. No one is ready, to be clear. No one is ready for what's to come in the next 2 years. No one has an answer. I mean, I think there was an additional pot of $15 million of discretionary funds for hunger this year to spread across the 700 emergency food providers in the city. That's not making up for the cuts to SNAP that's coming. The state is going to have to fill a gap. I don't know if folks understand SNAP, food stamps, is a federally funded program that there's a small percent that the states pay. And what the federal government is planning on doing in next year is shifting the cost share of the administration and of the product to the states. So you're going to see, I think the latest estimate is that next year, New York State will have to foot an additional $3 billion of SNAP funds just to keep up with what was being done. And so where are they going to find that money? Are they going to, so these are these sort of trade-offs that no one's really prepared for.
And that doesn't only impact the people who are expecting the food stamps, it has a cascading impact
For sure.
on the Can you say a little bit about that?
Yeah. I mean, SNAP is this massive program, right? 43 million people are getting food benefits across the country. Those benefits are spent in retail food outlets, bodegas, grocery stores. They are buying food from retailers that employ human beings. That food is being bought at the retailer from wholesalers. From that, it is going back to farmers. And you look at the effect back on the supply chain, farmers are going to go out of business because they're not going to have as much food to sell. This is a massive program. It's the same in school meals. We're seeing states deciding not to do summer meals when it's federally funded because politically they don't want to take federal dollars. And this is money that would be going into the supply chain and the economy of local communities. It's been bad messaging, I think, for a long time on anti-hunger work. The economic impact of SNAP, right? It's multifold. The person who gets the food, it's super important for, but what it does to that neighborhood, you want to see your bodega go away, or you want to see, the grocery store, all these things have impact, which is really, it's very scary.
Oh. can you say a little bit about like BJ's role and how how people can find their way in? And
I mean, I feel like BJ's role has been deeper than mine. Has been around with the West Side Campaign Against Hunger for decades and decades, and that's powerful. And I think it is important to think about that history. It's really interesting right now in that St. Paul, St. Andrews, that where we're housed, is fixing their roof, which is sort of a flip on BJ's roof issues from the past, which will upset some of our distribution patterns. But for us, we think more, to was it Tori today? Tori. Like, people need to do more mitzvah. People need to get more involved. It's not just at WSCAH. I don't actually really care where you decide to volunteer, but you should spend your time doing some volunteer work in the community. At WSCAH, we know we're going to have to serve more people, which means we're going to need more human beings unpacking trucks, packing up food, sorting food, handing out food. With our distribution points around the city, we're actually starting to add volunteer opportunities there, because it's sort of, I think for a lot of people, it's also really interesting to sometimes leave your neighborhood and go to Washington Heights and see a distribution in another community and what that impact is like. So we do a lot on our website, or you can go on New York Care's website. You can find WSCAH on there as a volunteer opportunity. You can sign up for shifts to volunteer. I mean, most of our shifts are Monday to Friday. They start at before 7 in the morning. They go to after 1 in the afternoon. We've been doing more, I think, and with B'nai Jeshurun, we've done a bunch. Family days, which we do more on weekends to bring, multi-generational families together and come and volunteer on a weekend, which we know is obviously easier a lot of times, especially for working folks. But it's us shifting our staff, right? Just to be clear, like, asking our staff to come in on weekends is a new thing for them. It's not their historical. So it's why we don't have it every weekend. But we're slowly but surely evolving that. Obviously, B'nai Jeshurun's been one of the deepest financial supporters as well of West Side Campaign Against Hunger for decades.
what's your budget
What is our budget?
today?
Our budget is about $13 million. I think when I came to WSCAH, we were at about just under $2 million. And you can say, oh, that's amazing, that's impressive. I mean, it's a sad state of affairs, right? It's like, we have to have that budget. We bought last year over $5 million in food. Like, that's our budget, that's our biggest budget line, is paying for food. We get the best price possible. Like, that's what we do with our roundtable collective purchasing. But we refuse to hand out just whatever someone donates to us. We're going to buy by the pallet and the truckload of the best food possible, because our customers are human beings who deserve that. If someone's like, look, I don't want to, like, I'm lactose intolerant. I want almond milk. Okay, let's have almond milk. If someone's like, environmentally, I don't believe in eating meat. Okay, let's make sure we have enough vegetarian options. Like, because you're poor doesn't mean you should have to be like, I don't get to be, I don't get to think about social justice, or I don't get to deal with my health issues. Like, so that's what we raise money for. And so, right, on Kol Nidre and Yom Kippur, like, B'nai Jeshurun for, I know, I remember, I forget her name before, Kiana. Larissa, like, it was her favorite day at work. She said she would come with this huge
Bag of checks.
The big bag of checks, and dump the checks onto our table, and we'd sit there looking, and it was like, this is incredible.
Santa.
Yeah, it was the most incredible thing. It still is the most incredible thing. And so we're super
We
thankful.
bring in, like, what is it, like, I don't know, $70,000 or something
I think
like
it's
that?
something like that.
Somewhere around that in a day, basically.
It's super powerful.
Yeah.
And that's, for us, it's sort of this, in some ways, it's the start of the holiday season. Like, obviously we do our Thanksgiving work, and we give out, we used to give out, we had 1,000 turkey challenge, then it was 2,000, then it was 5,000. Now it's the Healthy Food Holiday Challenge for a number of reasons, from sustainable food side, but also we started giving out 10,000 turkeys. And not that it's going to happen within B'nai Jeshurun, but we also give out pork shoulders, right? we have a lot of our Latino customers like, actually, I don't want a turkey. And so now we give out about 8,000 turkeys and 8,000 pork shoulders. But those numbers are astronomical, and we raise money for that.
Yeah. It's amazing. Please?
Because you said you buy the food, you also, like, City Harvest
Yeah.
Can you repeat the question since
Yeah.
we're live streaming?
So the question was on, so we purchase a lot of food. Where else do we get food besides direct purchase? Yes. I mean, I should say City Harvest, it's amazing. When we were, say, giving out 1 million pounds of food a year, we were probably getting 300,000 pounds, a third of that from City Harvest. That was donated. Now we give out 5 million pounds of food a year. We probably get about 750,000 pounds a year, and we focus it in with City Harvest. It's only fresh produce. So they're still an incredible resource. We actually don't get 1 pound of food from the food bank, I will say. It's sort of a misnomer that if there's 2 food banks in New York. We focus on fresh produce, so we get it from City Harvest. We also have started working with a group called Sharing Excess. So they started out of Philly. It was a college student at Drexel who was really into like food waste, and they've expanded into New York City. And what they do is they go directly to Hunts Point Market, which is the produce market in New York City, and we pay them an administrative fee. It's like 10 cents per pound of food across the round table. And they take all the food from all the distributors, and they go through it to make sure it's good, and then they distribute it and deliver it to us. So it's for us, we would have been paying for travel and all these things, so it actually is pretty much free in our mind. But right, City Harvest is a huge supporter. And how they work, right? They're picking up a lot of times from entities on the Upper West Side, and they want to give it back out as quickly as possible. So they will drop it off right at our place. They'll go to the Grow NYC farmers markets, and they'll pick up all the excess, and they'll bring it to us. Those are the big. I mean, City Harvest is the biggest. Sharing Excess, probably the second biggest. We have a few, like Hepworth Farms does, for example, they do their CSA at St. Paul, St. Andrews, in one of their stops. Whatever they don't hand out, they have a key to our walk-in cooler. They put it right in the walk-in cooler.
It's amazing. Yep, Betsy.
Where you were able to get the funds to increase your budget so significantly?
So the question was, how do we increase our budget so significantly? I mean, I think this is a credit to the folks who live and work on the Upper West Side. Like our core donor base is the zip codes of 10022, 23, 24, 25. It's human beings. Like unlike most nonprofits in our world, in anti-hunger, like I should have said this before, like we don't have any big federal grants. We didn't get any federal cuts. We have less than 7% of our budget is even city and state budget. Our funding comes from individuals, family foundations, community members. So it's how we reach out to schools, temples, churches, mosques, and those community members who come to us, volunteer with us, see the work, and if they have the means, or their law firm or their corporate group has the means, they're giving back. So we're quite an anomaly compared to most anti-hunger organizations in that way. But yeah, we've gone from, I think we have 10,000 donors on our mailing list, right? And that's what we do.
Hi. Is your mother baby program in other hospitals other than Columbia Presbyterian?
So the question was about our mommy and baby program. So that is a program that is funded fully by New York Presbyterian. In a sense, it's their program. So they literally fund the end-to-end. We charge them for every food distribution we do, for the engagement with the moms, for benefits enrollment, everything. So they pay for that out of their community funds. We've had conversations with like Mount Sinai and Northwell Health. We continue to have those conversations, and we're seeing there's this thing, if anyone's heard of the 1115 waiver. So Medicaid there's an insurance waiver was tested out successfully in North Carolina and California. It's a 2-year pilot in New York State right now. So right now the funds are still there from the federal government, and we think they will be for the next year. If you're Medicaid eligible, you'll be screened, and you can have home delivered groceries for free every week based on family size. So this is a new program that a lot of nonprofits are working on. So it's federally funded through the state. It's a massive, massive pilot that ideally will drive down healthcare cost by giving people access to healthy food. So in some ways, indirectly, it is scaling out. Like all the hospitals are getting involved through this Medicaid waiver that just in the last month has started to roll out.
You're doing digital, people that aren't on the computer, or?
So the question is, how do we, like, different ways of people getting food? Like, so most of our folks still are getting food by showing up at a distribution point. We test it out, and we'll continue to roll this out with our home delivery, where people go. It's actually a text-based system. What we've done is a number of choices people make by text. So it's not an app that they have to go on. Like, do you want alternative dairy versus regular dairy? Do you want vegetarian protein? And so we cater the mix of foods to the person. It's not product by product, but it's product category by product category. So, but other members, like, for example, Met Council has an amazing, like, and we're talking to them about this, about rolling this out further. They have a really robust model where you can order food online that is also linked to their inventory system, so which is really powerful for our warehousing side. So that is the future. Yeah, we just put in with Met Council, we've just put in a very significant ask to UJA yesterday to help other organizations roll out that program.
Great. Eleanor.
First of all, thank you so much for being here and talking to us and describing all the different paths that are involved in doing what you do. What I think about from a totally ignorant place is how many different things I see. I live in Lincoln Towers, many people here too. And I'll see all the time, Gail Brewer is posting free food. And she says what they're giving and how to get it. I don't pay attention because I don't need it. No, I'm not going to take free food because people need it. I don't need it. But I notice also that in the religious communities, there are a lot of programs that I didn't know about and learned about because I have religious friends. And they're anxious to connect kosher options with people. So I have the thought, and you probably do it already, how do sort of ordinary people like myself who are interested but don't know how to amass usable information so I could volunteer?
So I guess your question is, how do you access the information to get involved?
Not exactly. I think I can figure out how to get involved. But you talked about so many different aspects, and I have them also, additional ones. I mean, like, what does Gail Brewer do? Is she connected to?
She's our fairy godmother. I said she's our fairy godmother. She's incredible. Gail's incredible, right? She's, we're on text messaging very regularly. Like, if she's like, look, I don't want to just do food with you guys anymore. I also need, can you have a staff member show up to do benefits enrollment? So we have now a staff members going, I think, once a week to our offices to support their staff, because our team, it's their expertise, is doing benefits. They need to be dealing with other issues. So, and she's also trying to, right, she's always advocating for more funds for WSCAH and other emergency food providers in these sort of budget battles. Like, that's, Gail is everywhere.
She's tireless.
I don't know how she does it. But actually on the kosher piece, it's really interesting, so that it was one of the reasons we brought Met Council into the roundtable with us is because of their expertise in culturally relevant food. And they did a really smart thing a few years ago where they expanded that notion, right? Like, Met Council used to talk about kosher food. But if you read their literature now, they talk about culturally relevant food. And they went after kosher and halal, right? To say, look, they are the roughly almost the same issues. I used to do this work in London, and we dealt with different menus for different groups in schools and in prisons, and we can figure it out. But, they literally, Met Council embedded a staff member at the USDA to help them figure out how to expand kosher and halal food across the entire national emergency feeding sector. And so we take wins off of that, and we think about what products we can have and also how we can push people. Like, we're not doing as much distribution in those communities that have the highest number of need in terms of kosher. They hit a lot of those customer bases in Brooklyn and Queens that we don't. But that's where we take the lead, and not the lead, we follow and listen to our friends at Met Council.
Great. Sylvia.
How often can customers come to pick up food?
So at present, customers come to get food at 86th Street once a month. So it is a top-up at some of our home delivery program, and so this is all being evaluated through CUNY, the Urban Food Policy Institute. Like, with our home delivery models through New York Presbyterian, it's twice a month. And so we have other distribution points that are also twice a month. And we're trying to look at both, it's one thing to say, of course, if you give people more food, they'll be better off, but like, what's the sweet spot? Because that's what we want to figure out. Maybe do we serve, this gets tricky, you start monitoring how hungry people are. Like, how do you decide who should get once a month, who should get twice a month, 3 times a month, 4 times a month? We're not there. And unfortunately, this is the problem of scale, right? As we now serve over 120,000 unique individuals a year, like that's a large number. And it means in some ways, we've gone wider and not deeper. You can look at a group like Part of the Solution in the Bronx. They've kept to a very small geographic area, and they go deeper and deeper and deeper with those folks. And they could tell you how much people's income is, like, and be like, oh, we should add more to these people. But it's a tricky spot. But generally, it's once a month across the emergency feeding sector.
Also based on the fact that how many people in the family?
So in the pandemic, pre-pandemic, your distribution with WSCAH was based on family size. When the pandemic happened and we sort of exponentially grew, we sort of looked at our average household size and we topped up above that and said, we're going to go to a blanket, everyone gets the same amount. So if you're a family of 1, you're getting way more food but I think we were at like 2.5, and we said, let's just make it 3, a family of 3, and that's what we've done. So it's for efficiency. So it is not based on family size at present.
Jeremy.
Thanks so much for your work and for sharing. It's really, really so interesting and informative. Curious about how you think about your priorities. You've been here 8.5 years now. You've done so much in that period of time. You've described so many different avenues of your work in terms of working with partnerships, the roundtable, the upcoming SNAP cuts, et cetera. Like, how do you think about what you're putting your focus on as a leader? What would you say are a couple of key things that you're focused on looking ahead in the next couple of years?
Yeah, so the question was, what do I prioritize as the leader of the organization in the bigger picture, I guess? For me, it's transforming the emergency feeding system, writ large, nationally. And we do it through what we do, and this is the mindset of an independent restaurateur. I'm not looking to have a big chain. I'm not looking to be the biggest, but I think we can be the best and do things that are replicable. And so the roundtable is how we do this. What we're doing more and more going forward is we have a new website for the roundtable going up hopefully next week, and we're going to start collecting best practice. We're embedding in all of our big grants we get from some of the big family foundations. If someone's giving us a multi-year grant, we're embedding evaluation and sharing a best practice because we think we have models. For years, people have been showing up at WSCAH from all over the country saying, we want to see how you do this work. And we're like, okay, come visit and see it. But that's not good enough. We want to have best practice, documents, evaluation, and to be able to share that information to, in a sense, flip the tables on how emergency feeding works. I'm not the biggest fan. I'm not a fan of the top-down food banking system writ large that's run by one entity nationally. That Feeding America controls anti-hunger work across the country. We're considered this massive anomaly. And we want to not be an anomaly. We don't want to be the oddball. We think what we're doing is good. It's not the only model, right? Even across the roundtable. So I'm spending more and more time there's a balance of direct and indirect service. The direct side is in order to actually do the best work possible, we have to do great direct service. We have to be boots on the ground. I personally have to be able to walk outside of my office and hand out food or talk to volunteers or just be physically like a part of it. I don't want to be where I used to be, like in Washington, figuring out national policy and having no clue what was happening on the ground. So we do direct service and test out models and share that and replicate that. And then we push systems change through the roundtable. And we've actually built out another state alliance called the Alliance for a Hunger-Free New York, which is the sort of same idea to shift city and state policies. So we balance, and at the same time, make sure my team is feeling great every day. Like, you know, my job, I got yelled at by a community partner who was like, "You're not supposed to give access to yourself to everybody." I'm like, yeah, like, I'm sorry, that's not, is what we do is like, we're a team. We work together as a team, hand in hand. I don't want to be in a hierarchy. Like, truthfully, like, my mindset, I'm always like, I like checkers, not chess. Like, maybe I'm just simplistic, but it's important to make sure my team feels like supported, like emotionally and financially. Like, we make sure we pay our staff well. We give a lot of time off. We bring in social service people to work with our frontline staff members to talk them through issues. We gave massive bonuses to all of them during the pandemic. Why wouldn't we? They were on the front lines. So I think there's this balance of being cheerleader and to my team and being like rule breaker, like table thrower, more at the systems level.
I want to thank Greg for not only being with us today, but I mean, the transformation has been really incredible. I do want to acknowledge also Doreen Wall, who died this past year, who was the engine behind WSCAH for a very long time. She spoke at BJ a number of times, and her memory was certainly a blessing, and the way her work was handed off to Greg. And I mean, I marvel at the nimbleness that you've had to both be a direct feeder, but also have the imagination to shift the strategy to make it what it could be. And I pray there will be less need. It doesn't look like that's coming our way anytime soon. And so it's really our commitment to continue to support WSCAH in the ways that we can. We're trying to get better also at sharing out more directly the one-time opportunities for family days, but also the way people can sign up for those shifts that Greg is speaking of. And also, people don't only live on the Upper West Side, so there is the warehouse. I think there are more opportunities for volunteering there.
It is hard to get an individual volunteer shift at 86th Street. Like, there are we've been told there are Facebook groups that literally when new shifts come up, they're like, there's a craziness to it. But we are trying to get more and more shifts. But at 180th, there's more space, and it's fun, right? It's literally we are on the same block as the one train. You could take the one train 23 minutes to get off at 181st, and we are on that block, and you can come and volunteer. And if you've been at 86th Street, it's fun for that other experience because it's a very different space.
Amazing. So thank you to Greg, and thank you to all of you who are being here, and also share it out. You know, we're also doing this work with the lunch program, and this is part of our commitment. So as we move into these high holy days and knowing what's coming down the pike in terms of Yom Kippur, I hope folks will not only be very generous with BJ, but also very generous with WSCAH, knowing how many people are dependent on this food, and Greg has done an incredible job of making that possible for way more people. So Shabbat Shalom to everyone.
Shabbat Shalom. Thank you.